At Charles Twisazani, Sitel Kent Doshit I can. Kodo Aja Naho Gij, the Mondo Naki John, Kodohan Linin Hitch in A. Ko Altaisha Kodo, Sonadi Zendole, so there's an aid on here, Denda Ko, our creature in consoles and Lini, Behanetze, Kodeho Jodole, Chamana Hassan Yadil. Zillistan Twistan. Charles Hill Hayol Carno de tu halch elti halch ewan. Cada din anni sa an rebik a hojan. Ni yajane a wet ni glehon. Di bini bi into tonadilzen. Hachine la okodo de quis kanye dache ekodo. De kosentanast et adda bedi no ut art bije ilia. Do shin ut el bije ilia de ut al ati hon njikish. Do ati nalni. Ko adolto einitsin a kuitje. Ni hit alto dole, chomana hasan leini ho. Yat ahon nani kaidole. Hashin lago kon hane en lini indel I. Kon has twin hizani butche. Nint el kent dan lini kon. Ye nan tindole, be nani edole. Aro a atskon kon da isenils a idon hilkahot zoidon hinago. Etahot eni. Yat ehon nahot atole, yat eho hojongo. Nahast adole, llan hena de yel katole. Llan hena da katole, konjamana stan. O yugo honi tuzilzen, belana. Aro alla ani zenon hi ket adon len his it aje. Naka anahot yadole. Hashine la ani ekon. Ni hidene en linin hits up ke hastin. O hon nasko neje. Be ha enani lidole konde zihi. Yat eon hil nahot atole. Ni yego na il nadon hi jeda neske. Dan ango konde yat eon nani kaidole. Nasko neje kon. Hajo hon wade. Nan nishta hollo. Adon hon hin ta kes ni hin hat atan. Da de kon yat eon hon. Nakayat eon insen chamana hasan. Nasko neje be na nil ido be se nadni zendole. Ado kon hit lalso dan lini kon yat ehon khanda kedon kata holondo le kon. Adon hit lan lini lange de nishit season de jai. Is il inidan le is ni kadan le. Je bid op het gejata houdt edole rajin zago kon. Ni kan dacha adis jingi kon zel en bet has ango. Yat ehon hit na houdt adole. Adon hi konta del klipn hiu. Onesh gishna skango yata houdt edole. Ado kon alla ani zinon bil ina il ini. Adon hi ke lange ke ni da ke. Adon hi so ken hi na like. Kon o yun da istra betra yata houdt edole. Ishin ka Jonathan zini hon beleg ein ladole. Kon taba etodizin an shende behanana sit ole kon hinat ani alt kon belta hon londole. Adi de ben hiche ujanasli. Na je het edo shid ne. Kwa shen hinat an leni kudo. Shi yad lini ka kedo dasitani kon. Aje hon benanish il in do ado hon silendli do had shi benanish einat il do kon edo in kabelta hon londole. Kodoshin Hiyajan Lini Honorable Vice President Myron Lizer, you have the floor. Yaj.
Oh, yeah, thank you, Dr. Fowler, our Executive Director of our Department of Human Resources, Navajo Human Resources. So, yeah, yat ebene she Myron Lizer yenishe Comanche nishle toha na basis teen do Comanche deshe kasha deshanelli. It's good to be with you all this morning. Again, it is June 7th. Yesterday being the anniversary of D-Day, and Monday, and then today, Tuesday, our normal time for our COVID-19 Town Hall update. Thank you for joining us. And we do know that our numbers of viewership is slightly lower than normal, and that's a good thing. That has shown that the COVID-19 pandemic has been decreasing and waning a little bit. But today's update gives you some new numbers, some new updated tallies, and the numbers and the COVID-19 positives have been increasing ever so slightly. No real cause for fear or panic, but certainly to re-up on our mandates, on our words, encouraging our people all across the Neta here to continue to remain vigilant, stay safe. And as you know, our old slogan, stay home, stay safe, save lives, still rings true. Whenever you have doubt, whenever you have, I guess, just the anxiety of getting out and getting out abroad, then maybe just staying home is the best thing for us. Numbers just slightly rising over the weekend. 121 new cases nationwide here on the Navajo Nation. And then June 6th, yesterday, 35 new cases. So the updated tally shows 156 new cases in a 3-day period. So again, we're needing to re-up on all of our protocol and our safety measures that we're taking, masks and sanitizing consistently. How many of you are not doing that already? And maybe the mask part might be suspect right now for those of you that are watching and those of you that will watch. And certainly, I, run, especially when you get into our restaurants, those that are allowing in-person dining, where, we do have our masks off more frequently. So again, it's really about just continuing to remain safe because we take it potentially home to our elders and our vulnerable population. So that's really where, this narrative comes from, is saving those that are, most vulnerable. So you and I, we could be very, um, I guess, healthy and fit, but we still have, and we still interact with those that are, I'm a little bit more vulnerable in and around the Navajo Nation. So again, today's June 7th. Thank you for joining us. Our president, Jonathan Nez, is out in Tuba City today. Wasn't able to get on with us, nor with a video or not, but maybe he'll join us shortly. We're not sure, but we certainly do have our esteemed cast of health professionals here. After I give some little bit of more narrative here, I'll introduce our Dr. Jill Jim here. Thank you. And also Dale Yazzie from our epidemiologist team here. And this team has been very stellar in their helping us mitigate this virus and the effects of it on all of our people. We see our numbers very high, almost 1,800 of our dear loved ones no longer with us. But again, these numbers, we believe and I'm fully convinced that they would have been higher had you not all joined us in helping stamp this virus out on Navajo. We've been in the news on the positive side, which most recently, and then the negative side. As this pandemic kind of took off, and it was pretty hot and tense there for a while. But you all remain with us, and we thank you. We thank you for your individual leadership there at home in your community and out abroad in your workplace. So thank you for continuing to stay safe. Again, our new 3-day totals, 156 new cases. And I don't wish to tell you the lay of the land and what those numbers tell us. That certainly is for our own Dr. Jill Jim and on Del Yazzie here. But certainly just wanted to encourage you all across our land here at the Netfa, that you continue to remain vigilant. Those needing your vaccines, get out there, hit your public health service facility and, inquire. And those that are attentive about it or maybe hesitant, and get more information and to find out all you can about it, becoming confident. Knowledge is power, power is knowledge. So again, we just want you all to be safe there. And as we open up and recover safely, we've always felt like we could. Being a business owner, day one, day two, a lot of you all business owners too, we're trying to figure out how to open up and continue to remain safe, hanging up shields, even wearing shields and face masks yourself, because it was your lifeblood, it was your livelihood. And so staying open, staying safe, and opening up and recovery has been on the foremost of our minds. And so we continue to do so. We look forward to, and we have been joining many national and global discussions on economic development, business development, energy development, out there and abroad. These are the times to be having these conversations. We don't wish to be left behind. And when we fully open, perhaps we could be placed there in queue, so to speak, and checked there. So to be a part of any new developments that are going to be taking us to our new horizons. As you know, our nation needs jobs. Our nation needs revenue to replace the revenues lost 40 to 50 million a year from the closed Navajo generating station. And so we have been working very feverishly, all of our division directors, all of our leadership, even our 24th Navajo Nation Council and our Department of Justice, the three-branch government, having convened this morning, talking about different things. And we are in the midst of the budget season. So your government leaders here and all of our program direct managers and our supervisors and all the employees, it's all hands on deck mentality here at the great Navajo Nation in order to continue to bring services to our people, direct services and indirect services. So it's been amazing to watch the team work. And so our hats off to the team, the Navajo Nation, our enterprises who have donated consistently. And so everybody's shown up. There hasn't been one iota of I guess, non-response. Everybody's showing up and they're showing out right now. So we'll continue to work like it depends on us, but continue to pray like it depends on our Creator, which it does. And so we appreciate the prayer. Thank you, Dr. Fowler, for your kind words and your offerings of blessing and encouragement for all of us. So again, just to recap, 35 yesterday, 121 over the 2-day weekend, giving us a 3-day total of 156. Now, I do apologize. I don't have our surrounding state numbers and what we look like. I'll pick that up again next week. And President, again, Jonathan Nez in Tuba City, out in the field, probably in a suspect area where there's no broadband, there's no quality internet service. So we do wish him well and safety out there. And we just want you all to know that as we continue to see our numbers escalate, continue to mask up, sanitize, get your vaccines, your boosters, those of you that need that. I know many of you have done so. We are the most vaccinated population or ethnicity or people group out there, and it's well documented. So hats off to you. Yeah, Shidane, we appreciate you and your leadership. And you are all leaders. Again, I mentioned your households, your communities, and your workplace, your churches. And it's just goes without saying that we have been working very hard, and we can't let our guard down. We have to continue to be vigilant and be safe around your safe. Be vigilant about your surroundings. And as I say that, I'm reminded of some crisis, some very bad things that's happened in the recent days. Our prayers go with those 21 who lost their lives in Uvalde, Texas. We've had prayer teams with them. We've talked to pastors, boots on the ground. People have gone there from the Navajo Nation. I guess a shout out to Pastor Nate Lynch to the City Assembly of God, who and his wife Marietta, who went to Uvalde and just wanted to help. And when we don't know what to do, sometimes all we can do is pray. And really, that's probably the best thing. Pray to our Creator, Shijadi, and God, that to give us the words to say. And some of us, if we have access and have contacts out there, use those and get more information. So 41 people injured, maybe still in the hospital. That's the latest number. And continued prayers for them. And also down in White River, we are brothers and sisters down there. They lost one of their finest, an officer, Lopez, and prayers for him. And it's affected the Navajo Nation so much so we have family members that have been impacted. And also we've sent our own 10 of our own Navajo Nation's finest down there, the men in brown, the people that we back, the people that we love so much are lending support and aid as they recover and mourn the loss of their dear loved one, Officer Lopez. So again, I believe the funeral is Saturday, set for Saturday. So our prayers continue to go out with them. May God bless the people of the White River Apache Nation. So we love them, we care for them, and we're actually supporting them right now. So prayers for all, and we continue to pray as leadership, and just want to be servants. to be servants of all the people that we can, and through our prayers we can certainly access the supernatural realm and the ability to pray and lift up our brothers and sisters. So thank God for giving us that opportunity and touch your people in Jesus' name. Amen. So there you have it. I think I am all given the updates that we have. Again, we'll rejoin you again next week. Thank you for joining us, and continue to share with your family and be ever so vigilant, not only for the virus, but just what this day and age, this present time is showing us. And be prayed up, and reach out to your loved ones, tell them you love them, even those that you have a bad relationship with. Just offer a word of encouragement, and I'll bet you, and I guarantee you, that'll lead to further dialogue where relationship healing can occur. And just simply the simple words, I love you, Shiaj, I love you, Shijah, goes a long way. So let's re-up on that in our relations. Let's make ourselves the strongest nation that we can be. So at this time, I'd like to bring on Dr. Jill Jim, Executive Director. Oh, we have our president available here. President Jonathan Nez, we appreciate you being able to be on the call. So without further ado, ladies and gentlemen, the president of the Navajo Nation, Jonathan Nez.
Tan hinasigido shaden sudin zinigi ishi be danit edo le licha punda anil tsoshiko so the zin be had a seat z pinda arashanada vice president kudoshi gatos zinigi nihi nika yanigi do nakayas tigi edo here bedini do le kudohane nihi chekuna iyila akonda the more not leona kitchen da nashona di de kusinskagi na states at the bikij na nashigi do kudo ka nejagi e banda huilne she pon falchin ala e de yasa nind kon he ya ade eno senigi hada iso gizigi shi kudo na tiendo hait e kon hi Washington as aj na nashidek die stoit ini kon san hik eni hinna beta dolna tagiche adi asa nezati no ba ashla di no ba hastkhane el taiko hik eni hinna beta dolna e kon patso dilzen ado hik eni hinna aro sa ni tsa jitenda tagiche zli so e ba he ni tsindiyen chi ba da wi ni ado di ultra has ago e ni falchen da istra se bido aje da ultra gidole na kits da ultra gidole hotta da ultra gido konsa lan falchen skoda illa banana shida illa do da istra e shido benina sahande kleo oyo de deskit ne bike apaka akonde kon sabe yelti adainos ne ashwane kon nihe chinto nihe ze bikidas tio kon tada do ka ado ze do di ze bikijna neshigi da hallo nakha da sishi qadish ladin do ba large nikinda khaygi e yakon nakha at booster de shinigi so ashwane kodoni hijo ba deni ke shkeno lini nakha da tse da hofya contre de krach da ita shin lego sande itleo ako hastra kesla inzado bella eshilche so trado de sto da osado de sto hot edo di de kosentragi na hast ets ata di dosne tashkena fini aro kodo lan hik eni hinnen hitsa anda it's da jitten don da is te do di in biche na ol te da di ne edo Aidan Linigi the Quitchiko, so the Zenbade kid, Ado Bedachnik or the Shkano Thini. He Washington has Aj, a Tsilidane, Linigi Dr. Jill Jim, Washington, Jado Bakagish Kiji, Spa Hayajado, Roseland So, Aod Alka Nature, Honey Kane in Bandahit, Ado, the Hotel, Ya. Not source had the guidelines that the graduation promotions and that leho hot out in not source had the hot out a lahande tle to le basso tit the no the sad not source the baka ado the fair do parade no a do she a ya kadi change a andalia akonde yego de des kido e ya doshi eshi do hot e do des eshi do da do shi ba al ne do des akonde dj e ashon zel in dan dazna lo e do la koni ki keni ne but do na i chuda yo in da di zegi vaccine ki shi yego na ne shot ashi keni so even nachi e kodo hanen hi chugo de liya do le ado konshi ataha ne ninda kri she yado sha do tsita she bin shra akonde ni kodo masan e channel no fingi da e kon khada st ngalchin biche yada ki ashkhode nkhada tse zegi ni nkhada ne ho e di jo biche di khatski lo biche di khawada shikeno fin so die kodo hanen hi chugona de ne to de to आज Dr. Jill Jim she could also he chukuna de net they adana de net or the ado kudoshi ad nek echin he hasi to the shashi atkat the hosnet or the sha ko atadon ni se ala de lagana keche de yada kare de nek echin he hasi to the joshi ba the hosnet or the lagana keche so kol so she and then he chukuna de shlad or the to hada ino slido ada she kaino slini so Dr. Jim, nishi kodo niche kushlet ole. Hela anofto.
Kwa ike non shik edo shidane ankwa. Daisunot anki kwa. Thank you, President Nez, also Vice President Leiser, for your continued leadership in making sure that we continue to respond to the COVID-19 pandemic. Adishi, I want to just re-emphasize the importance of the 3 W's that we've been talking about, making sure we mask in very enclosed areas with limited ventilation and indoors and outdoors, especially when we're meeting with individuals outside our household, continuing to regularly clean. And this pertains to either businesses or office spaces across the Navajo Nation. And then continuing just to watch your distance as you're meeting with individuals, clients, and just maybe families that are visiting from out of the area or from the city, because the new variant, I think that we have been talking about, maybe not new now, that it's been spreading across the United States for quite some time, the BA.2.12.2, which is a different subvariant of Omicron and seems to be more transmittable. So we're just encouraging everyone to take all the precautions that we have been asking to do, although the numbers are increasing. We don't see an impact in hospitalizations, and it really lends to show that because of our situation, we are not imposing any new restrictions through public health emergency orders, so everything stays the same. We encourage individuals to continue to get vaccinated if they have not. And if you're eligible for a vaccine or a booster, please be up to date on those vaccines as well, so that you continue to protect yourself. Also, the Test to Treat program, the COVID test kits, home test kits, they are available at health facilities and also your local CHR program as well. And also, even though you have a home test kit, to make sure that you follow up with the health facility regarding your positive test to see if you can get early treatment. The Paxlovid is very effective in reducing your symptoms and hospitalization. So the goal of all of this prevention is basically to make sure that we try to make sure that our relatives and ourselves, we don't end up in the hospital. And I think they're basically to avoid that severe illness and hospitalization. So continue to just inform others, whoever is listening on this town hall today. You're sort of our messengers through social media. Not everyone logs on, some might be video or watching this at a later time, but hopefully you can share some of this information with your family members today or relatives or neighbors just to keep them up to date, because at times I think when we leave the reservation, when we're out in the city, it just seems like everything is back to normal. There's no mask requirements, there's no gathering requirements. And so here in the Navajo Nation, we have not really gone to that extent. We still know that COVID is still around. There's still a major disaster declaration for the emergency response. And we also are very careful, and we care about our elders and our family. People are still testing for COVID right now, and it sometimes it is sort of we feel we have anxiety over that if our family members test positive, and we just want to make sure they safely recover, and you're still caring for people that that may be at risk for COVID and might get sick too. So Ashipahas because it brings us back probably memories from the beginning of the pandemic, where we know that Delta may have a little bit more of a deadly virus or variant compared to Omicron, and now we have vaccines that can help us. So so really be careful. And when we do advise you guys, we're not putting restrictions on things that we want you to do in your normal life. We want that to still be available. So we leave it up to you to take on that responsibility to not only think about yourself, but others in your family and the community and as a tribe, because it takes each one of us to make sure that we take all the precautions that we can to take care of ourselves and others. So I just wanted to reemphasize that, as some might be starting to panic as the numbers are starting to increase again, and that might cause some stress. So just know that we have the tools and we know what those are, so we just need to practice them. So so thank you for listening and joining the call today, and for our leadership to always providing COVID-19 updates on a weekly basis as well. So I'll hand it over to Del, and he can provide information. So Del is part of our EPI team. So take it away, Del.
All right, thank you, Dr. Jim. Hello, everyone. Thank you all for joining the town hall. I'm going to provide a quick update on the latest numbers that we analyzed yesterday, which covers a 7-day time period here, May 27th through June 2nd. But before I move on, I'd like to acknowledge our epidemiology team for COVID on Navajo Nation. All the partners here on the right side of this slide, from our Navajo Epicenter, IHS, the Navajo Area Office out of St. Michael's, and then some THOs and 638 facilities on Navajo Nation. We have virtual partners working with us from CDC and CDC Foundation. And then we also have partners from Johns Hopkins, and then also from COPE, and also TGen helping us conduct some of the COVID strain surveillance on Navajo Nation out of the Flagstaff campus. And then, of course, our state partners from Arizona, New Mexico, and Utah. These are all our partners that are part of our epidemiology team. I want to acknowledge them, and we really appreciate their work and partnerships. So this is recent cases and trends, the last 60 days, going back to around early April. Since then, we've been going on this upward trend. You see the red line here, it's a 9-day weighted center moving average. The trend has been going up to, as of June 2nd, we are at about just under 60 cases as a weighted center moving average over a 9-day period. So it is going up a little bit, which kind of reflects our 7-day infection rate being above 1. Right at 1 is our threshold. So we've been above 1 for about, I'd say about a month now. We'll just continue to monitor that. Here's case incidents across Navajo Nation. Just over here on the right, there were 274 new cases in the 7-day period from May 27th through June 2nd, which puts our 7-day case rate at 173 cases per 100,000 people. And then over here geographically, the IHS service areas here, Chinle, Shiprock, Yala, Fort Defiance, Crown Point, all in this darker shaded brown color, which means they're all at above 100 cases per 100,000 over a 7-day period. And then Kayenta, Tuba, and Winslow with the 50 to 99 range 7-day case rate per 100,000. And then our bordering states are all in this brown color as well, meaning they're all over 100 cases per 100,000 as a 7-day case rate as well. And then some additional metrics here. The lab-based test capacity is now at 17%. This did go up a little bit from last week. I think last week was 12%. So it went up by 5 percentage points. There were 586 average daily tests conducted over a 7-day period. So testing is still going on across the nation. And then the other metric is hospital capacity. We look at hospital beds being occupied by COVID patients. And these are inpatient hospital beds, so at 65% of all the facilities across Navajo Nation. And this has been remaining steady for quite some time. So I know Dr. Jim alluded to this, that even though we're seeing an increase in cases, people are not requiring being in the hospital. So of course, that is a great sign. And then the ICU beds, the intensive care unit beds, has also been remaining steady as well at 54% average daily occupancy across Navajo Nation. So these percentage points are remaining steady, and which is a great sign. Then vaccination status among Navajo Nation residents went from the completed primary series. This is the first 2 shots of Pfizer and Moderna, and also 1 shot of the Johnson & Johnson, is now at 126,141 Navajo Nation residents have completed the primary series. The up-to-date, meaning that these are the people who have been got the first booster. So like the 3rd shot is now at 85,195. Navajo Nation residents are up to date. So 45% of our Navajo Nation residents are at least received the first booster or the 3rd shot. And then we're almost at 70% of our Navajo Nation residents have received the first two shots, the primary series. So this is as of 5/27. This is last Friday. So that's the vaccination numbers up to date. And then this is the epidemic curves for Navajo Nation in orange and the US in blue throughout the pandemic. So just over here on the right, you see both the US, the blue line, and then Navajo Nation orange line are, continue to go up, although across the US, the latest reporting period, you see a little bit of a plateau here. We'll see or continue to monitor that across the United States. They are seeing like less cases. I want to say like the past 4 days across the US. So it reflects this little plateau here. But on Navajo, we're still a little bit on this upward trend. This is the 7-day case rate bar chart comparing Navajo Nation to the 50 states. So Navajo Nation here in the orange bar or yellow bar here at about 173 cases per 100,000 over a 7-day period, which puts us at about, I think, at 31st position comparing to other 50 states. So we're working kind of right in the middle. And then Colorado, New Mexico, Arizona, and Utah here in the red bars. So there's still a lot of COVID cases around us, bordering states. Just this morning, I saw, I think New Mexico has jumped now up to like number 15. So just since June 3rd forward to now, New Mexico has jumped up to like, I think 15th position. So New Mexico is seeing a little bit of an increase in COVID cases of the past 4 days. And this is a 7-day case rate per 100,000 across the US. As you can see, the West Coast and up in the Northwest, Nevada, Colorado, New Mexico. Still a lot of COVID cases, as Dr. Jim mentioned. We're on Navajo Nation and also around us. This is community transmission. I see a lot of red, going back to red across the US, meaning high community transmission of COVID, just within our area as well. All the counties in Arizona, Coconino, Navajo, Apache, and then New Mexico side, the McKinley and San Juan counties. Up in Utah, the San Juan County, they're all red. So this COVID strain surveillance was just updated this morning. So report 58, June 7th, comparing report 57 to 58. Just one new case with the Omicron B1 variant and the sublineages, the BA sublineages. That was 1,745. Then there were 43 new cases identified with the BA2 Omicron lineage, which includes the BA2.12.1, which is now the predominant variant across the US. I don't think we can really say that on Navajo Nation yet, because a lot of our samples are still being sequenced. There's a little bit of a backlog currently, so we'll just continue to monitor going forward. But there were 43 new cases identified with the BA2 Omicron sublineage. And the other highlight here is the Delta variant now has been downgraded to a variant being monitored. It's no longer a variant of concern. It's just a variant being monitored. So it went from up this part of the table to down here. There's just one new the Delta variant identified this time around. All the other variants identified on Navajo Nation remain the same. And this was just updated this morning as well. The CDC variants profile, this is across the United States. Really now this red bar, the BA2.12.1 is currently the predominant Omicron variant or the sublineage, making up 62% of all variants, followed by the BA2 at about 25%. And then the other highlight is that this BA4 and BA5, the green bars here, have now made their appearances on this profile, even though they're kind of still low as percentages at 5 and 7%. So those are some highlights of this latest CDC variant profile report. High-risk chapters on the nation. There were 32 new chapters that made the list. Last week there were 24. So this also continues to increase as the number of chapters make this list. And these chapters going back in time all the way to going back 6 weeks, roughly. These chapters have been on the high risk chapter lists over time. And last, just in summary here, the risk level assessment, there was a little bit of a 5% change from the previous week as far as a bit of an increase in cases from last week. And then our 7-day case rate is 173 cases per 100,000. And so that's a high COVID risk and transmission on the nation. The Omicron variant, the sublineages of BA2 and the BA2.12.1, these are becoming I think eventually is going to become the predominant variants on the nation going forward as we continue to do more sequencing of the cases going forward. So supplemental metric here is the lab-based test positivity increased to 17%. Last week was 12%, so it did go up a bit. And last, a little bit of good news is that even though there's an increase in cases, our hospitalization percentages remain stable. For hospital bed at 64%, ICU bed at 54%. So this is pretty much at the end of May. So that's our latest report on the COVID situation on Navajo Nation. Thank you to our EPI team, Dr. Jim, and our Navajo Nation leadership, President Nez and Vice President Leiser. And I'm going to hand it over to, I'm going to stop sharing and hand it over to Shema. Dr. Fowler, please take it away. Thank you.
Ike shiaj aro ka ben hil nahasin nei aro kodoshe dast anugo naka atkat nahashnet ole shik edoshid ne di kodo nat ani lini asa kodon hich nazi jo edi nashnihi ati nashnihi hil nido do shid do na do no zi it eda hala ati chikish aro hashino la ze lini naka alia ba hehni zen aro din dal ka nalni nal kahi gi jo aj do hashinella na has twin hizani chilke doj ketan long ajan dal kahi do ba he ni zendo which he ni zinc aro di hashino la o wadon le chiyan da di hachito haze betata des palita na hon hidene betra ni jo do ba he ni zen ako ano hon wade so tani jo aden to nat ani hahilan hit na kon kedo sutahi aronana lanje da sutahi kodo ze lini na hahadad na haladi ati nasnito ati jikish that iya jo eti hachido hazeta despai onzaj no hachil in ado chiyi ado lota haho ada jo kwa hajeta da so jo e na do yon jikish e beta aholian hilne ado has tra des is al ni hitra inos sendon hitra na chipo ado di bilaganek e guidelines dilne ashine la baby o in le da haslago donna atago jo e di big no idon le chostoitini benda sedi da benda klahida jo e da nas ne lo da hosen ako adna gabe eta aholiano be eta hausi hala an hitnin hinatani hada deitza dan yego dan hitsa den na des kido diha ishi banda al dehi go honen da al dehi ishi no hodol ne jo ada nti ich ke stron hitnin hinatani ako ze lini na hadal ne hitna aro kodo en lini is ajabetula data sutani e kodo o yennan hitni Ashin zago o ben dan hini nin hitchidon de abeta de des balon dakre o kodi the kosnas states out da petit nini lao and or nili a variant petit ne a cook adjikishi a ba.2 de a subvariant a omicron it's ando lao and or nili a ka oyon jikisha na yitla a konda ho wanda a test kit so the whole e chade e hot e kode lat na chado atre e ze en ije e aje la be da holla o ko o yugo a hinda I da hija e be da holia ga shin klata ozel koso da hat khani ka ko da je e ko o yo yi ya jinzen da leto be da hu yango e na anhi gango ne da hasta da hino syndrome da fitine Aro kodoshi yaji hol na igi edit atso na dino atso yor kafe da don lake at dia istas cheledi zlibi na ki yor kafe jo ena kidomona atlet aje din nal kato yen litin da hadne ako ane e tadin da al kahi asla as zina ba het ni think o yunanish e Aro di oyot idon hits out that des kid jo egg at oyon hits out de kid akoditos judget na kidneza dino asos tadon ati akone la e betadorna akonde jo bedorna igi e do at ende is en ilne sadada jo e khashine la shedi is en lini bahal yado aje panapa akodit ahanda al khai e Shlapi in the desk in the Alkahi, Ado is an ibitnahas, Ano e ati, Anahas, do e art ene is an int ahohat the benda. A kodi is it been up in Ilyai Nahata Yai, the e that Khan in Hata, e tos dino ashla the Demilia Joaslad Nezat dino nas at dino ashla, Jokunella e is it Dini art ene Hatalia. Jadi is twido sani nothini fango e adre peso ze a large bell ka e here. Ada di islatin ka hot zon hinago ta hot ehi jo adre de nana kil. A koti yo toja adre e o yo yego de des kid e shi ba ako hiado adre da do yashkonde a be da ako hia. Ako ado di variant bit nini jo e dis dindo ashla. Bigahon hits out the desk. O di delta de nene e o yo ya anni lo cadence. No hon ne e hot aro di cards at the di partners and rebel mas angle cards at the e ya high risk nabit on ni eshi kodoyen hit na has na e bebe na hinon kinchik edo shit ne. O di ben hit na wheel net jo ajet the model na kijone. Na hwylne na an tin it ashik eroshidne o kosabe eta ol ini ihe hashino la bik ahonos ini ihe aro hashino la e bik et yalti jo e an hin holni o is lini shahadolni no zi on hadolni ni hikodo e ben na ini ka ba na ini ka na ga sini ben nache do shahadolni zano e an no holni o konda hon wanda ist a win sin a shield do ya at e halati do ist a hol zani jo e ade ishi nas nehi ade khata peke esto o koti ho wanda na anish na gloshi da beta English ada hunen ne ko tan ta to khahi judik a o yugo a ndalia ta atanako ta a ndalia na a ho khita pesna huito a ta non le ke traho ta khata enne do o yugo at a songen ten sa to yeni panta alte it's ospeta a jishikota o konto yago to tan hiti nida o konto yada ata holia ni hinago be etaha o si ajo e ata ahayani e ni hini ke chik edo shidne ado na nishollini ni hito ata holia a akhanti ishi bendal nishin o ado PPE zahaji chorus wipes at dahano e da benda hot o jo an hinit out en hiketol to kondo ati oyot I don jikis jo e kodo opa hanna it don hilya at ho do a e banahanne Dannossano e ado hata a kisse a jeshi to na nishta hollo a kod khazad lini pahasti ko eina kodo hajon hiza pa holian ntan hiti ni hito a benil soit a ni hitinek it o tkhli it a banda huilne ado pesh bahanne eta bijet granata hitzi ko ni hito a shonde ta hitinossen do nat anin lini ta dinossen an ni edo at energi an si kestande Johnny e ol I dol at jo e si benatje is de sinle jo an niet e galle den gil behasen ni gil gada det den gil behasen enna ba a holiado baso chik edo shidne kon sa gashin gil nata hasil net dolle do na de modo na kijone si ade hanada okis Adon hi masandon hi change madon hi je bachata akisi edo hen hi ni do lejik edo shidne kon so shin do le do hi nata hasidne don jonon hi eta do a do ya at edo na hi he